Magandang araw sa lahat. I'm Laurence Go, the data lead of the Data-Driven Development Program of the Action for Economic Reforms. So after learning about the different types of data collection, in particular moving from paper-based to digital data collection, today we'll be learning about data quality. So first, we will talk about what we mean when we say data quality. So what is data quality? Second, to better understand the concept, we will break it down to different aspects. So what are the different dimensions of data quality? Third and last, I will share with you a basic framework on how to assess your organization's data quality. So before we begin, if there's only one thing that you should pick up from this video, it is the idea of the data quality principle of garbage in, garbage out. What does this mean? So what this means is that if we have poor quality data or kung pangit yung input natin, pangit din ang kalalabasan nito. So if we have poor quality data, whatever analysis that comes out of it will also be poor quality. And by extension, this analysis will inform the policies that we'll be crafting, and so the policies themselves will also be of poor quality and will not reflect the reality on the ground. So we have to remember garbage in, garbage out. So let's start. What is data quality? Data quality is basically the state of quantitative or qualitative data or information. So basically, it is how reliable a particular data set is. And it talks about the ability of a data set to serve its specific and intended purpose. So now we have a general idea of what data quality is, but later we'll be able to have a better understanding by breaking it down to its different dimensions. Okay, so now the question is, why do we care about data quality? So as we've mentioned, the principle of garbage in, garbage out, so sound policy decisions are based on sound data. Again, if pangit yung data na gagamitin natin para gumawa ng mga polisiya, yung kalalabasang polisiya ay hindi rin magiging maganda. And so, decision makers or policy makers would need to know whether they can have confidence in the data that they have, or that if they could be making decisions based on misleading data. So we have to be very careful to rely on data that is not of high quality. We have to make sure that whatever decisions we make will be based on high quality data. So now I'll be talking about the different dimensions of data quality. Although different sources will have different types of data quality dimensions, today I will be discussing the 5 most common dimensions for data quality. So first, we have validity or accuracy, then we have reliability, and then timeliness, precision, and finally, integrity. And in the next few slides, I'll go through them one by one. So first, we have validity or accuracy, which is basically a measure of the correctness of data. So simply, tama ba yung data na nakokolekta natin? What this says is that the data should represent what is supposed to be measured. And in other words, does the data describe the real-world object or event being described? So, ano po yung examples nito? First, for example, if we want to talk about people's health, ano sa tingin natin yung magandang indicator para ma-measure yung health? Is it, for example, the presence of some illness, So for example, nagko-collect tayo ng data on diabetes or for example, some other diseases? Or should we rely on weight and height? Or alternatively, is it enough for us to rely on age? And of course, in general, mas maganda po na ma-measure ang health if we actually ask about the presence of diseases or illnesses, because we don't think that weight or height would be enough to represent someone's health. Neither would age, right? Another dimension or another aspect of validity and accuracy would also come in the form of, for example, dates. In terms of dates, sometimes we might be measuring dates using, for example, yung 2 days muna. So day, month, then the year. Pero it's also possible that in other data sets, we measure it starting from the month, and then the day, and then the year. So for data to be valid and accurate, we have to be sure which format is actually the format that we're using, and we have to be consistent because otherwise we might be mixing up the dates, some of the important dates, especially when we're talking about health data. So for example, for COVID, kung tama po ba yung dates na nilalagay natin sa data. So how do we try to improve the validity and accuracy of data? Here, I think important yung dimension of administrative versus survey or self-reported data. In the previous modules, I think we've already discussed this, but I think it bears repetition. Especially for more sensitive data, karamihan ang mga survey or self-reported data might not be as accurate. And that is because, for example, if tatanungin natin yung mga tao tungkol sa vaccination status or sa presence of illness, disability, or for example, variables like income, most likely po hindi nila sasabihin ang totoo or mag-underreport po sila kapag tinatanong natin sila. So in this case, it would be better to have administrative data sets. So ang ibig sabihin po ng administrative data sets ay yung mga data sets na kinokolekta natin in the process of doing operations. So for example po for health, when we have electronic health records, that would be considered as administrative data set because while for example, barangay health workers, the doctors, nurses, midwives would interview the patients, doon po nila malalaman yung presence of any illness. The same with income, for example, if we talk about tax data, baka po mas forced po yung mga tao to report their right income. So in a sense, I think in general, ang sinasabi po natin ay ang administrative data would be a bit more or more accurate and valid than survey and self-reported data. Second naman po, we have reliability. So reliability would refer to the idea that protocols or procedures for data collection should not be changing. What this also means is that data defined, measured, and collected in the same way over time by different people should be similar. So, ano pong example ng reliability? One good example po for reliability is household income. Ang tanong po natin ay paano ba natin dinedefine ang household income? Ito ba ay agricultural income lang? Does this include yung non-agricultural sources? How about po yung mga transfers or remittances from abroad? Do we include that as well? So for reliability, to happen, we want to make sure that the definition or how we measure data or variables remains constant through time. Ang pinaka nagiging issue sa reliability is due to changes in data collection instruments. So for example, pag gumagamit po tayo ng mga forms at naiiba po yung pag-define natin ng different variables. So for example, last year, nung kinolekta natin yung household income, ang tanong natin ay ano po yung household income excluding remittances. And then for example, this year, pinalitan po natin ang ating definition to include remittances, then this would not be considered reliable kasi nag-iba na po yung definition, nag-iba na rin po yung tinanong natin sa data collection instrument. A solution here, of course, is that we can maintain po the same definition and then maybe add another question kung nakatanggap po ng remittances at magkano ang natanggap ng particular household na yun. And another possible factor is the implementation of the data collector. Possible din po na hindi naintindihan ng data collector yung definition ng household income, for example. So dito, ang pinaka-solution natin is that we should be able to train the data collectors to understand ano po yung definition ng household income. Another common mistake would be ano po yung definition natin ng household. Sino po ang mga kasama sa household at sino po yung mga hindi kasama. So dapat clear din po ang ating definition para ma-make sure natin na reliable ang data that we are getting, whether from surveys or from administrative data. So, ang pinaka-concern natin sa reliability is yung changes ba in the data that we see are a result of true changes or just errors in data collection. So, for example, nakita natin na tumataas ang household income through time. Totoo nga bang tumataas ang household income or dahil lang to sa, for example, sa pag-include ng remittances through time? So we want to be sure that it is indeed as a result of the true change in incomes and not the errors in data collection. Next is the dimension of precision. So precision is basically looking at whether the data we have is collected at a sufficient level of detail to permit informed decision making. So in our case, the general rule is that the level of the precision of the data should be smaller than or the same level at which decision is made or policy is applied. So, ang ibig sabihin nito ay if we want to be able to provide ayuda to households, ang data natin ay dapat nasa level din po ng households. Bakit po? So, for example, ang criteria po natin for providing ayuda is that a particular household should have, for example, less than a certain amount of household income. Malalaman po natin yung household income only if we have data on the households themselves. For example, if we have data on the barangay level of the average household income for that barangay, hindi po natin malalaman kung which households ang may mataas or may mababang household income if it's only at the barangay level. Ito po yung meaning natin kapag sinasabi natin the level of precision of the data should be smaller than or at the same level at which the decision is made or policy is applied. So, if we want to know which households to give ayuda to, we should have at least household level data or better yet, individual level data to understand kung sino yung dapat nating bigyan ng ayuda. And just to emphasize the point a bit more, we would like to highlight the difference between yung aggregated versus disaggregated data. So in general, we think that the more disaggregated the data, the better. Bakit po yun? Kasi kapag may aggregated data na tayo, hindi po siya posibleng ma-disaggregate na. So for example, if we have municipal or city level data, hindi po natin malalaman from that level kung ano po yung household level or ano yung individual level. Pero if we have the other way around, if we have the disaggregated data, if we have the data on individuals or the data on households, pwede po natin itong i-aggregate to the barangay level or the city or municipal level. That is why in general we say the more disaggregated the data, the better. So this is just echoing po the example that we provided a while ago. If we want to provide ayuda at a household level, would it be enough to have just the poverty rate of the municipality? For example, alam po natin na munisipyo natin ay 30% poverty rate. Makakatulong ba to sa pagbigay o sa pag-alam kung kaninong household magbibigay tayo ng ayuda? Siyempre, hindi. What if alam natin yung barangays na mas mataas at mas mababa ang poverty rate? Makakatulong ba to? Somehow, yes, although hindi po siya enough. Kasi even within, kahit sabihin mong sa isang mahirap na barangay, meron din pong mga households doon na mas nakakaangat. And even sa mga barangay na akala natin ay mababa yung poverty rate, meron pa ring households doon na mas mataas ang poverty rate. So if we actually have the household level poverty rate, then we would know mas madali po nating maita-target kung kanino tayo magbibigay ng ayuda. The fourth dimension is timeliness. So basically, this pertains to the degree to which data is current and available. So the question is, does data represent reality from the required point in time? And I think a very timely example would be for COVID. Given the importance of making decisions to stop the COVID pandemic, how often do you think do we need the data for COVID? How frequently should we be collecting such data? So for example, think about the scenario na let's say nag-collect lang po tayo ng data ng COVID monthly. Kung monthly lang po natin tayo nakakakuha ng data, masyadong late na po yung policies and programs or interventions that we can do, and therefore baka masyadong malala na po yung COVID at hindi natin siya masolusyonan. Pero in the current case where we are collecting daily data, at least we can see whether cases are going up, and as a result, ano po yung mga lockdown or quarantine measures that we need to do. For timeliness, we want to emphasize the difference between high versus low frequency. And basically, in general, what we want to say is that we should be collecting data as frequently as possible. Pero ano yung ibig sabihin ng as frequently as possible? It's basically that we should be collecting data as frequent as decisions need to be made. Ano po yung example nito? So kanina nabanggit ko po yung COVID, and in the case of COVID, napaka-importante po na ma-update tayo daily. We need to know how many cases there are to be able to make decisions on the quarantine classifications, on the lockdown decisions, and for example, vaccinations and other interventions. So we need to know the COVID cases on a daily basis, and that would dictate how frequent we should be collecting the data. But for example, in the case naman po of DRRM, so in order, for example, to prepare for evacuation, we want to know the place of residence or home address ng iba't ibang individuals or households. Pero this type of data, we don't really need to know this every day. Hindi po natin siya kailangan i-collect every day. So, pwede naman po sigurong either on a quarterly basis or yearly basis, given that we don't really make decisions on evacuation on a daily basis. And we also don't expect the place of residence to also be changing on a daily basis. So a connected or related tip would be to digitize the data collection. Sometimes or most times when we digitalize data collection, nag-i-improve po yung frequency. So hindi na po siya nakadepend on how often we encode the data, but automatically na po siyang nasasama sa ating database. And so this is one solution to increase the frequency at which data becomes available to the policymakers. The fifth dimension is integrity. So ang ibig sabihin nito ay yung absence o yung lack of error, bias, or manipulation. So ang common causes dito ay transcription error, so habang ina-encode, nagkakamali, and data manipulation. So yung sinasabi nating error ay hindi po siya intentional, pero kapag sinabi nating data manipulation, ito po ay intentional. So for example, again, sa COVID-19 cases, sometimes dahil sa encoding error, merong mga cases na from yung status nilang patay na sila, nabubuhay sila after a day or two. Or sometimes may sinasabi ring issue na baka nag-underreport ng COVID-19 deaths. And so this would be an issue in terms of manipulation kung sinasadya po nating hindi i-report yung mga deaths sa COVID-19. So how do we make sure that the integrity of the data is kept intact? So usually, ang tip natin is to digitize data collection. And this helps because we don't have to do transcription po or encoding, which leads to human error. Kasi alam naman po natin mahirap mag-encode, minsan nakakaduling, and this really results in simple data entry errors, and so hindi po natin napapansin. By digitizing it, unlikely po na mangyari ito kasi from the beginning, the collection is actually made digitally. Another thing that can be done apart from digitizing data collection is also by verifying the data through spot checks. So basically, we want to be able to document each step of the collection process. So alam po natin kung sino po yung accountable for each step of the process. And we can also do validation. Ibig sabihin po nito is we can randomly check the data and then check kung tama nga po ba talaga yung pag-encode or tama yung pag-collect ng data sa particular step na yon. And finally, we can also triangulate. So triangulation would basically mean na i-compare po natin itong data na nakuha natin sa ibang sources of data. So just to make sure that indeed the data is accurate and it's free from error, from potential manipulation. Apart from the 5 quality dimensions that I mentioned, some data sources would also include the following. So the first thing is consistency, or whether the data is consistent across different databases. So for example, is a particular individual's name the same in different datasets? So for example, ako, Laurence Go. Pareho po ba yung spelling ng pangalan ko in, for example, the listahanan database? Pareho din po yun sa CBMS. So if you want to be consistent, the spelling of the name should be the same regardless of the dataset that we're looking at. Second, completeness. So meaning nito is that data is complete and that there are no missing values. Minsan po, when we're collecting data, sometimes either the respondent refuses to answer certain questions, or sometimes hindi po natin or mistakenly na nalalagay yung answer or response ng particular respondents. So as much as possible, we want to make sure that there are no missing values. Third is accessibility. So whether data is available, accessible, or retrievable, or in other words, machine readable. So sometimes we have a notion na kapag ang data ay digital, immediately po siyang accessible. Although this is not necessarily the case if our data sets are in PDF or in JPEG or image format. Ang digital data that is most available or accessible is if it's machine readable. Machine readable po ibig sabihin kung naka-Excel na po siya or naka-database format and hindi na po kailangang i-edit or kailangan gawan ng additional process, pero kaya na po siyang agad-agad na ma-i-analyze. So as much as possible for accessibility, we want machine-readable formats. After knowing the 5 main dimensions of data quality, now we move on to doing a data quality assessment. So what is the data quality assessment or DQA? It's basically a strategy to assess the strengths and the weaknesses of the data. And it is a way to verify the quality of the data and to create corrective measures to produce quality data. So how do we do it? So we go through each dimension and we have different questions that we have to answer with a yes or a no, and write some comments on whether the reason for we say yes or we say no. So for validity, we have the first question being, does the information collected measure the intended result clearly and adequately? So ito po yung example natin on health. Ano po yung best indicator or best measure if we are considering health? And maybe even within health, baka magkaiba po yung definition kapag iintindihin natin ay maternal health versus child health, right? So that is the first question for validity. Yung second po ay, do results collected fall within a plausible range? So for example, meron tayong senior citizen dataset, and within the age variable, nakita po natin na may ages 50 to 55. Is that something that we are expecting given na senior citizen po siya na database? So we have to check, maybe meron pong encoding error or possible manipulation. Pangatlo, is there reasonable assurance that the data collection methods being used do not produce systematically biased data? Isang example po niyan ay baka po minsan nagpapasurvey po tayo sa Facebook, pero yung munisipyo po natin ay maybe 50% lang po ang may Facebook. So by default, yung 50% po na walang Facebook, hindi po sila makakasagot doon sa survey na in-administer po natin. And fourth, are sound research methods being used to collect the data? So similar din po sa example ko kanina, we have to make sure that we need to be able to pattern our research methods with the need or yung intended purpose of the data set. If we want to survey the Facebook users of our municipality, then we can use Facebook to survey them. Pero po kung gusto natin, for example, mag-survey tungkol sa ayuda, maybe it's not the best platform if we think that karamihan sa mga nangangailangan ng ayuda ay wala naman po sa Facebook. So in these cases, we have to think and we use this list po of assessment questions to identify or to decide whether our data is or can be considered valid. Next, for reliability, we have two questions. First, when the same data collection method is used to measure or observe the same thing multiple times, is the same result produced each time? So ito po yung sinasabi nating measurement, for example, of household income. So we have to make sure na yung definition po ay pareho regardless of how we ask it, who asks it, and when we ask it. The second question is, are data collection and analysis methods documented in writing and being used to ensure the same procedures are followed each time? So maganda rin po na when we collect data, we have documentation din po to understand whether our data is indeed reliable. Next would be precision. So is the level of disaggregation at the level of the decision to be made? So ito po yung nabanggit natin kanina na criterion for precision. Next is the data collection method or tool being used to collect the data fine-tuned or exact enough to register the expected change. And third, would an increase in the degree of accuracy be more costly than the increased value of the information? So nasabi ko kanina na as much as possible, we want to have as precise data or as disaggregated data as possible. Although sometimes that might be expensive. So sometimes if we only need household level data, collecting individual level data might actually be too costly in terms of time and money. So we have to be able to balance the two considerations, and this is question number 3 is about this main trade-off. So for timeliness, we have the first question, which is, are data available frequently enough to inform program management decisions? So again, this is our sort of definition for how frequent it is. It is as frequent as decisions need to be made. Second, are the data reported the most current practically available? And third, are the data reported as soon as possible after collection? So frequency or timeliness, it is not just about collection, but also how fast we're able to report the data after we collect them. Sometimes, syempre, hindi rin naman po useful kung mabilis tayo mag-collect ng data, kung araw-araw natin kinokollect ng data, pero hindi naman natin siya nagagamit at that same frequency. And lastly, we have integrity. So are procedures or safeguards in place to minimize the risk of bias or data transcription errors? Second, is there independence in key data collection, management, and assessment procedures? So ang idea dito, sana magkakaiba rin po yung mga assigned officers for data collection, those who manage the data, and also those who validate or to check or verify whether the data is accurate. This is to make sure po na mas mapapataas and mas magkakaroon ng integrity ang data na kinokollect natin. And lastly, are mechanisms in place to prevent unauthorized changes to the data. So we have to make sure we know who have access to the data and who among our staff or officers can make any changes to the data, just so we can hold people accountable if there are any issues in terms of data integrity. And I'd like to end with some tips to improve the data quality in your organization. So the first one po is to leverage administrative data sets. Although it's very useful to have self-reported survey data sets, it would also be nice to have administrative data sets which are collected in the process po of the operations, the daily operations of an LGU. So isang example po dito ay yung mga business registration data for LGUs. They can serve as an important data set or source of data for the businesses and establishments within the LGU. Next po would be to make data definitions consistent. As I mentioned a while ago, for example, if we want to collect data on household income, we have to make sure that our definitions are consistent through time and regardless of who collects the data. Third is we think that getting more disaggregated data is better. It's more helpful because it's easier po to just aggregate the data, but it's impossible to disaggregate the data if you have a very aggregated data source. So remember as much as possible to collect household level or individual level data. Next would be higher frequency data would be better. And this is because so we can use these data sets for faster decision making. And again, it's not just about collection, but also how frequently we're able to report or to use the data. Next, we have to make data machine readable. So this is part of making data accessible not just internally but also to external stakeholders. Because sometimes even if we, for example, collect disaggregated data and very frequent data pero po naka-paper po siya, mahirap po dahil kailangan pa nating i-encode. So if they're digitally collected, they're immediately machine readable and easily used for further analysis. And again, all these can be helped by having a digitized data collection method. So this would respond to data disaggregation, to frequency, and also making data more machine readable. And I think these 6 tips would help improve the data quality in your LGU. And finally, I'd like to leave you again with the data quality principle, garbage in, garbage out. We want to make sure that the data that we collect is the highest quality possible, so the policies that we craft using such data will also be the best in shaping people's lives. Thank you very much.